The purpose of this program series is to introduce you to the protocols and procedures of the oral and maxillofacial surgery clinic facility. In this first program, you'll see the physical facilities, you'll learn about the people who work here, you'll get acquainted with the forms and procedures you'll be using, and we'll also show you the instruments you'll be using. We'll get into working with patients in the second program. And the third program will take you through an actual patient's visit to the clinic. Patients are referred to the oral surgery clinic from the oral diagnosis department, from clinic floors of the dental college, and from clinics or practitioners outside the College of Dentistry. When patients come in, they stop here, letting the clinic secretary know they've arrived. In addition to greeting patients, the clinic secretary files patient charts, records advance appointments, assigns patients to the care of the dental assistants, and is responsible for patient recall and the recording of patient payments.
Okay, Teresa, I'll take her back.
Another important member of our clinic team is the dental assistant. The dental assistants will provide you with the instruments, equipment, and supplies you request for a procedure. Our dental assistants are also responsible for the cleanliness and asepsis of the treatment unit and the sterility of the instruments, clothing, and equipment within it. The assistant also accompanies the patient to the treatment unit, but normally does not work with you as a chairside assistant. Another student usually serves as a chairside assistant if you need one.
Here's the x-rays, Connie. Connie, I'm going to need to have Dr. Blaustein sign this before we can start.
In case of an emergency, the dental assistants can get you anything you need or bring an attending staff member to you. They'll also make available to you the proper payment and procedure forms.
Here's some instructions for you to take home with you. I'd like you to read them
Dental
now.
assistants can also give you a hand sometimes when you give post-operative instructions to the patients, especially if there are language difficulties. Some of our assistants are multilingual and can help you communicate with your patients. I want you to be sure to understand, though, that you, and not the assistant, are responsible for the proper completion of paperwork and delivery of the proper post-operative instructions.
Connie, we're going to need to see her for a medical consultation. Could you reschedule her for next week, please?
Okay, sure.
An assistant must accompany your patient from the treatment unit upon completion of the case.
Teresa, Ms. Williams has to come back next week. Can you give an appointment?
The assistant will relay to the secretary your instructions regarding further appointments or recall of your patient. The next member of the clinic team is the clinic supervisor.
Here's my work order for today, my attendance.
Looks like you need to make up a little time.
Yeah, I missed a half a day.
Students register their attendance with her. The supervisor maintains attendance records, and if time permits, she can schedule makeup time for you. She has charge of the assistants and their schedules and is responsible for updating their education. She is also responsible for supplies and equipment. She is a registered nurse and works on special clinic projects.
Let's just double check that. And okay, you're all set for the 20th.
Okay,
Both the morning and the afternoon.
that's fine.
And now we come to the last members of our clinic team, the faculty. Yes. We're here to assist you in every way possible to make your experience here a valuable one. We'll supervise your procedures and we'll grade and evaluate your work. We must countersign all charts and work orders, and only faculty members can sign prescription orders for your patients. As you gain in level of skill and experience, the level of supervision of uncomplicated procedures will decrease, and you'll be encouraged to attempt procedures of greater and greater difficulty. Now let's take a look at the sterilizing room. This is the sterilizing room. As you know, we must maintain the chain of asepsis for the protection of the patients. So this room is a very important part of the oral surgery facility. All the clothing, instruments, and equipment we use are cleaned and autoclaved here by the sterilizing room staff. Let's talk about the clothes you'll be wearing. The scrub suit is the main item of clothing worn to maintain asepsis.
Here's your hat, and your gown, and your pants.
This scrub outfit consists of a scrub shirt and trousers for male students and scrub dress over scrub trousers for females. All students wear hats provided with the scrub suits. These articles of clothing can be obtained here in the sterilizing room. After you sign for them, the return of scrub suits is your responsibility.
Here you are. Here's your shirt. And your pants. And your hat.
Okay.
Please sign your name for these. Okay, you'll be responsible for the scrubs. We won't issue you a new set until you bring back the old. Also, if they're lost, you must pay for them.
Thank you.
You're welcome.
Male and female locker rooms are to be used for changing. Currently, junior students wear blue or green scrubs, and seniors white scrubs. These color differences permit the faculty and staff to make rapid assessment of the experience level of the students working in the clinic. A name tape is to be worn on the scrub suit top while you are in the clinic facility. You can see that these suits leave your arms bare. No jewelry is to be worn with these outfits. That means no rings, bracelets, or watches. Another thing, you can't leave the clinic area wearing only your scrubs. If you have to leave the clinic area, you either have to change back to street clothes or wear a laboratory coat over your scrubs. Now we're here in the conference room, a very important part of the clinical facility. You can see the reference books in the wall shelves. These books may be used here in the conference room, and you'll find them very useful for working up your cases. Now let's go over some of the paperwork you'll be using during your rotation. This is a standard patient chart with its medical and dental history section and its charting section with indicated procedures marked in red. This is a temporary chart or white card used for patients here on an emergency basis. Here is the abbreviated medical history section. This is the consultation record used for external consultation when we wish to find out more about the medical status of a patient. This is a patient screening form for patients with complex procedures who need to be referred to advanced students, either seniors or first or second year residents, or to the university hospital. These are the post-operative instructions in English and also available for Spanish-speaking patients. Now we'll follow a series of forms you're going to be using. Work excuse card, the standard work order form, the attendance form, the prescription form used for pre- and post-operative medication and to be signed by a faculty member. And finally, the practical examination. Now I'd like to list some of the procedures you'll be doing over the next 2 years. These will include exodontia, both uncomplicated and complicated, on both high and low-risk patients, pre-prosthetic surgery, including such procedures as alveoloplasties, tuberosity reductions, and frenectomies, biopsies, both incisional and excisional, and intraoral drainage of dental-alveolar abscesses, as well as post-surgical care of your patients. These procedures will be done in the treatment units. Now I'd like to take you over and look at some of the equipment we have available in these units. Over here we have the treatment chair with its adjustment panel, the overhead light, the Mayo instrument stand, and the drug cabinet with its contents. And here, the sink with its scrub equipment. Over here on the countertop, we have items that you'll use very often in your procedures. A sphygmomanometer, sterile gauze, local anesthetic carpules, sterile pickups, topical anesthesia, sterile saline, thermometer, a mirror, explorer, and periodontal probe, and a jar of anodyne paste. This is a sterile pack. This sterile pack contains the following instruments: a local anesthetic syringe, mirror, clamp, a periosteo elevator, a suction tip, a water bowl and a mesus basin, and a bulb syringe. Here we have a handpiece and burrs. You'll be using these for sectioning teeth and removing bone. Forceps and elevators are the primary instruments you'll be using. Let's look at the forceps first and go over their uses. First, the maxillary forceps, the number 1 straight maxillary anterior forcep, the number 150 maxillary universal forcep, the number 52 maxillary anterior forcep English pattern, the number 65 maxillary root tip forcep, the number 53 a paired forcep for right and left maxillary molars, number 88 maxillary anatomical forceps paired for right and left maxillary molars, and the number 210 for maxillary third molars. Then the mandibular forceps. The number 13X English pattern lower anterior forcep. The number 31 English pattern anterior forcep. The number 151 mandibular universal forcep. The number 17 or semi-anatomical forcep for mandibular molars. The number 23, the cowhorn forcep for molars. Next, let's examine the elevators. The number 34S or straight elevator. The number 11 or spade elevator. The number 301 straight elevator. The number 303 back action elevator. The crane pick. A pair of apical elevators, the Heidebrink elevators, and a straight Heidebrink elevator for apices. A paired set of elevators, the Potts elevators, generally used for third molars, maxillary. And finally, a set of paired elevators, the Winter Criers, generally used for molar roots. We've gone through the clinic facility and met the people who are here to help you. We've looked at the forms you'll need, the instruments you'll be using, and the procedures you'll be doing. Have we left something out? Correct. The most important part of all, the patient. How you relate to and work with the patient is what we'll be discussing next. But first, let's take a break. This part of the orientation to the oral and maxillofacial surgery clinic will cover your treatment of patients. We'll describe history taking, chart review, case presentation, aseptic techniques, and postoperative instructions.
I'm Nancy Spencer. I have an appointment.
History taking is usually the first contact between the doctor and the patient. The level of rapport you establish with your patient at this time will often carry over for the duration of your contact and is one of the factors determining a successful procedure. The history provides you with the following general elements: the events which cause the patient to seek treatment, and a summary of those facts relevant to the state of your patient's health. Before we get started, let's look at some do's and don'ts of the interviewing technique. Conduct your interview with the maximum amount of privacy available. The medical and social history of a patient is a confidential matter. Listen to your patient. Be empathetic toward your patient. Comport yourself in a courteous and dignified manner. Don't ask yes and no questions. Don't ask negative questions. And don't ask leading questions.
Hello, how are you today?
Fine.
Good afternoon, Mrs. Spencer. My name is Pat Carroll, and I'll be the one that'll be examining you this afternoon. But first, I'm going to take a look at the records.
Okay.
After the patient is seated by the dental assistant, and before you start the history-taking interview, briefly pause and look at the patient. Is the patient male, female, young, old, heavy, slim? You may observe some conditions which you'll want to follow up on later in the history-taking interview. If you do, jot them down. The elements of the history are covered in a systematic manner and in a standardized order. This procedure for taking a medical history uses as its basis a review of organ systems. First, a brief statement in the patient's words of his or her chief complaint.
Mrs. Spencer, what's bothering you today?
I have a toothache on my lower right side.
Next comes the history of the chief complaint, or history of presenting illness. This is the single most important element of the history. Here, the patient describes the progression of events which led to the seeking of treatment, from the beginning to the present.
And how long has this pain been there?
About a week now.
A week?
Then comes the past medical history, or PMH. In this portion of the history, information is gathered concerning the state of your patient's health from birth to the present. This information is arranged and recorded in a standardized manner and includes previous hospitalizations with details in chronological order, any previous surgical experiences and complications, any previous general anesthesia and complications from anesthesia. Then the patient is asked if there is a history of infectious diseases, any childhood diseases or specific infections.
Mrs. Spencer, do you remember having any type of childhood diseases or anything like that?
Yes, I had measles when I was 5.
Any allergic problems are considered next. Allergies to food, airborne allergies, any drug reactions. Next, you'd get information on medication the patient has taken previously, both over-the-counter products and prescription drugs. This is followed by a history of any hypertension the patient has had. Following this, find out if the patient has had a history of cardiovascular disease. This would include congestive, ischemic, valvular, and rheumatic heart disease. Next on your past medical history form is a request for any respiratory diseases your patient has had, such as asthma, the frequency of attack, the date of the last attack, and medications used. Any history of emphysema, chronic bronchitis, pneumonia, and bronchiectasis. Then the patient would describe any past neurologic disorders, such as seizure disorder, cerebral vascular disease, other neurologic disorders, and psychiatric disorders. Ask the patient if he or she had any blood disorders, such as anemias, coagulation disorders, and sickle cell disease. The next item on the history form is gastrointestinal diseases. This would include peptic ulcer disease, jaundice, and inflammatory diseases.
Mrs. Spencer, do you remember having any type of liver disease?
Yes, I had infectious hepatitis 4 years ago.
Then
4
you
years ago.
discover if your patient has had any history of renal disease. This would include infections, chronic renal failure, dialysis, and/or renal transplants. Another element of the history is endocrine disorders. This includes diabetes mellitus, both insulin-dependent and non-insulin dependent, thyroid disease, and adrenal dysfunction. After that, ask your patient if there is a history of urinary tract disorders. Then, the patient should relate any history of skin disorders.
Do you have any problems with your skin now, Mrs. Spencer?
No.
No?
If your patient is a woman, you take a reproductive history, asking about pregnancies and deliveries she's had, if there were any complications, and if oral contraceptives are being used. This would complete the past medical history portion of your interview. Ask about the prevalence of certain diseases in your patient's family, and take a family history.
Have either of your parents ever had any type of serious disease before?
My father has mild diabetes.
Then you would take a social history of your patient. This would include birthplace, areas your patient lived in, occupation, and drug use, if any.
Do you work?
No, I'm a medical student.
This is followed by a dental history. This is a chronological history of your patient's dental experiences to the present.
Have you ever had any extensive dental work done before?
I wore braces.
And how old were you when you had the braces on?
12.
A brief physical examination of your patient is then performed. This includes taking a blood pressure and pulse. Then, a complete oral examination is given.
Okay, now I would like to take a look in your mouth.
Okay.
An actual history-taking interview will be a part of the third program in this series, and you'll see the clinician gathering relevant information from his or her patient. After recording the information given to you by the patient, you ought to be able to form a picture of the patient which can be summarized this way: why the patient is here, how long the patient has had the problem that brought him here, what medical problems are present which might cause you to alter normal treatment procedure. If these medical problems are present, what changes must be made in your normal treatment plan, what your diagnosis is, and what your final treatment plan will be. Your next step is to present the case to the faculty. In a teaching institution, the case presentation serves two purposes. It makes certain that appropriate therapy is planned for the patient, and it gives you the chance to expand upon your ability to evaluate the patient and plan surgical therapy. The case presentation is made either here in the conference room or in the treatment unit, and is generally done employing the technical terminology of our profession. This increases efficiency of communication. On the other hand, the history-taking interview is conducted in a language necessary for the patient to understand you. The actual process of presenting a case is a replay of the history-taking interview in reverse. The case presentation is systematic, with the emphasis shifting from problem solving by you to data transmission to the faculty. Please remember that the case presentation is a formal procedure to be carried out in the following manner. State the patient's name, age, sex, and chief complaint.
The patient's name is Mrs. Nancy Spencer. She's 26 years old, Caucasian female. She presents today with pain in the right mandible.
Next, briefly review the history of the chief complaint, the past medical history. Describe any exceptional physical findings, both systemic and oral. Finally, describe the findings from the radiographic examination. Make a diagnosis. That is, name the disease process that is responsible for the patient's chief complaint.
She has acute pulpitis in number 31.
If it is impossible to make a definitive diagnosis, Provide a list of possible disease processes in descending order of probability. This is known as a differential diagnosis. Last of all, outline your proposed treatment plan. When carried out correctly, a case presentation takes just a few moments. You might be interrupted during the presentation by your instructor to explain a point or two. It is your responsibility to understand what implications information gathered during the history interview might have on your proposed treatment plan. You must demonstrate a familiarity with the use and pharmacological actions of drugs and medications that your patient might be taking. When you've presented your case and have been given permission to begin treatment, you will perform a surgical scrub. This procedure begins the local chain of asepsis around you and your patient. With the scrub complete, you will glove and begin treating the patient.
Okay, Mrs. Spencer, we're all set to begin treatment.
All right.
There are some common errors in technique which break the chain of asepsis and endanger the patient. After you've gloved, avoid touching an undraped light source. The assistant will drape the light handle. Avoid lowering your hands below your waist. Avoid touching your hair or face. Don't touch charts, x-rays, pens or pencils. Don't touch instruments or equipment that are not on your surgical tray. If you need something, ask your dental assistant to get it for you. The technique you are using is aseptic, not sterile. It will take you a while to become used to working under these conditions, but it will soon be just another skill you've mastered. During treatment of the patient, there are several unbreakable rules. Do not leave your patient unattended during treatment for any reason. If you need assistance during treatment, ask the dental assistant or your student assistant to notify a faculty member. Remember, if you have presented the patient's case, the responsibility for the well-being of that patient is yours. When in doubt about any step, or if you're faced with an acute medical or surgical emergency, call a faculty member immediately. When the surgical therapy is completed, you will give your patient the proper postoperative instructions.
Mrs. Spencer, these are some instructions I'd like you to follow.
Okay.
First verbally, and then in written form. These instructions are important for the successful completion of your therapy. Be certain that the patient understands them. Record the completed procedure in the chart. Clearly, but briefly, describe the procedure you performed. Indicate any complications which occurred during the procedure. If your patient requires no further care in the oral surgery facility, indicate in the chart that the patient is complete in oral surgery. If your patient is to return for further treatment or for postoperative observation, record this and the date of the next appointment. Sign the chart and have it countersigned by the faculty member who has been supervising the case.
I'd like to make arrangements for you to come back next week.
Okay.
Teresa, can I get an appointment for Mrs. Spencer for next week, please? Mrs. Spencer, bring this card in with you next week, too, for your appointment.
Okay.
And Dr. Blaustein, could you send that off, please? Finish off the case.
If she requires a long-term observation, just give the chart to Teresa and she'll put it in the recall file.
Okay. I'll see you next week, Mrs. Spencer, for your appointment.
Okay.
Bye-bye.
Well, we're finished. You're now familiar with the clinic facility. You know the people who work here. You're familiar with some of the procedures you'll be doing and the instruments you'll be using. And you're familiar with the forms you'll be using. You have some idea how to take a history and how to present a case. If you're ready, let's get started. third program in this series will take you through a patient visit to the oral surgery clinical facility. It is meant to serve as a review of the first two programs and to test your powers of observation. In this program, deliberate errors are made in the procedures you have been shown in programs 1 and 2, as well as what you have learned during your oral surgery lectures. It is your job to find these errors and note them. After you have seen this program, and before you are allowed to treat patients in the oral surgery facility, you will have to pass a short quiz. Some of the questions will be based on the material in program 1 and 2, while others will test your ability to identify some of the errors in program 3. After you've taken the quiz, we will view the program again and point out the errors. You should be aware that errors in technique, procedure, and interpretation are present throughout this program. While some errors would normally stop a procedure immediately, for educational purposes, please assume that the error has been corrected as the program proceeds.
Hi, I have an appointment.
Joyce Jackson, please have a seat. Connie, reception area, Connie. Oral surgery, please hold.
Yes, Teresa?
Connie, take us to Dr. Riley's unit, please.
Okay, Joyce Jackson? Hi, you want to follow me? Mrs. Jackson, this is Dr. Riley.
Hi, Mrs. Jackson. How are you today?
You want to take your coat off? Okay, you want to have a seat right in that chair, please.
So, Miss Jackson, how are you feeling today?
My tooth is killing me.
It says here you're supposed to have tooth number 3 pulled. I'm going to ask you some questions about a medical history. All I want you to do is answer yes or no for me, okay? Have you ever been hospitalized or had any serious illness or operation?
No.
You out in the care of a physician?
Yes.
You taking any medications?
Yes, I'm taking aminophylline and these pills.
Do you have any allergies?
No.
You ever bled excessively?
No.
Are you pregnant?
No.
Okay, I'm going to run through a list of diseases. You just tell me if you've had them before. Heart disease?
No.
Asthma?
Yes.
Rheumatic fever?
No.
Kidney disease?
No.
High blood pressure?
No.
Liver disease?
No.
Diabetes?
No.
Hepatitis?
No.
TB?
No.
Or sickle cell?
No.
Okay. Okay, Miss Jackson, I'll be back in a couple minutes.
So, Mrs. Jackson, did you have any trouble getting here today with all that construction outside?
Yes, a lot of miles.
Yeah, it's really a mess. They've had the streets torn up for a long time now. If they're building an L or something, it really makes it hard to get into the building.
Where do you hold the branch meeting?
As I mentioned earlier, it works on the proximal convoluted tubules. The salt is removed there, and then later water is reabsorbed at the distal convoluted tubules. Well, what can I do for you, Riley?
Doctor, this is a patient who's here to have tooth number 14 removed. She says it hurts her a lot. She's now under the care of a physician who has her on aminophylline and some orange pills that I've never seen before. Physically, she seems okay. Here's an x-ray of the tooth.
Okay. What are you going to do for her? What kind of a procedure are you going to use on her?
Well, basically, I'd like to use a number 17 forceps and simply luxate the tooth until it comes out.
Okay, you go ahead, but call me if you have any trouble at all.
Okay, thanks, doctor.
And both the distal and proximal convoluted tubules are part of the basic kidney unit, the nephron. And this is the unit that removes all salts from the urine.
How long ago did you take? Okay, I'm back. Okay, I'm just gonna numb your tooth up with this needle, okay?
Connie, reception area, Connie.
Oh, I feel sick. I feel like I want to fight.
How do you feel?
I feel sick. I feel like I want to fight.
Don't worry about it. It's probably just nerves. We'll be back in a couple of minutes, okay?
Alright. That sounds like something
Hey,
the doctor
Tom.
really
How you doing, Riles?
All right.
Good to see you.
Yeah, what's up for Friday night now?
Well, you know, we were going to have the party later on, but what I'd like you to do is you and Diane stop over at my place before.
All right, who's gonna be there?
Players, Mo, the Grub, you know, the usual list of characters.
Do you want us to bring Connie?
Yeah, why don't you ask her, see if she wants to come with, okay?
All right.
Because I know Mo and the Grub said last time they really enjoyed her company.
She was a riot.
They
I
said
couldn't believe
they
it.
said she was the life of the party, to be truthful with
She
you.
was. She
Yeah.
really was. Do you want us to bring anything, you know, beforehand?
Why don't you bring like a case of beer, okay? Because I already have like some mixers set up,
All right.
okay?
All right, that'd be no problem.
So we'll see you about 7 then,
All
okay?
Excuse me. I'm going to get back to the patient.
All right. How many people can we expect afterwards?
Figure about 25 to 30. It'll be a small party,
All right.
okay?
All
So
right,
we'll have more than
okay.
enough to drink.
All right,
Okay,
I
Riles?
get back. Yank that
I'll see
suit.
you later.
All
Okay.
right.
Good
Bye-bye.
luck with that.
All right. Okay, I'm back. Okay, let's get that tooth out now. Open real big.
Ah. 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 Ah.
write down on that. That wasn't so bad, was it? Here's some instructions for you to read, and I want you to follow these for me. Okay, Connie, we're all done. I think you can take care of Joyce now for me, okay?
Okay. Okay, Mrs. Jackson, you want to come with me? Okay, Teresa, Mrs. Jackson's all finished. You don't have another appointment? No, that's it. Take care of yourself.
We're going to pause here and distribute a short quiz. The answers to these questions should come from your previous lectures and programs 1 and 2 of this orientation series. We'll stop the tape for a few minutes while you answer the questions. Then we'll come back and re-examine the program and point out the errors. Stop the tape now.
Hi, I have an appointment.
Joyce Jackson, please have a seat. Connie, reception area, Connie. Oral surgery, please hold.
Yes, Teresa?
Connie, take us to Dr. Riley's unit, please.
Okay, Joyce Jackson? Hi, you want to follow me?
Not bad so far.
Mrs. Jackson?
Uh-oh.
Dr. Riley?
Note that the student is improperly dressed. He has no cap on and is wearing a watch. The chain of asepsis cannot be maintained this way.
Okay, you want to have a seat right in that chair, please?
So, Miss Jackson, how are you feeling today?
My tooth is killing me.
It says here you're supposed to have tooth number 3 pulled. Let me ask you some questions about a medical history.
The student's manner with the patient is, to say the least, casual, and his choice of words like pulled is not likely to set the patient at ease.
No.
You're out in the care of a physician?
Yes.
You taking any medications?
Yes, I'm taking aminophylline and these pills.
Do you have any allergies?
No,
You ever bled excessively?
no,
Are you pregnant?
no.
Okay, I'm going to run through a list of diseases. You just tell me if you've had them before. Heart disease?
No.
Asthma?
Yes.
The history-taking
Rheumatic
technique
fever?
leaves a great deal to be desired.
Kidney
There are
disease?
far too many yes and no
High
type
blood pressure?
questions,
No.
and there is
Liver
insufficient
disease?
follow-up
No.
when positive data is
Diabetes?
elicited.
No.
Hepatitis?
No.
TB?
No.
Or sickle cell?
No.
Okay.
The patient's history of asthmatic episodes should have been followed up in much greater detail. By the way, I hope you noticed that the patient's chart indicated that tooth
Okay,
number
Jackson.
14
I'll
was
back
to be
in a couple
removed,
minutes.
not tooth number 3 as described by the student.
So, Mrs. Jackson, did you have any trouble getting here today with all that construction outside?
Yes, a lot of noise.
Yeah, it's really a mess. They've had the streets torn up for a long time now. They're building an L or something that really makes it hard to get into the building.
Where do you hold the branch meeting?
As I mentioned earlier, it works on the proximal convoluted tubules. The salt is removed there, and then later water is reabsorbed at the distal convoluted tubules. Well, what can I do for you, Riley?
Doctor, this is a patient who's here to have tooth number 14 removed. She says it hurts her a lot. She's now under the care of a physician who has her on aminophylline and some orange pills that I've never seen before. Physically, she seems okay. Here's an x-ray of the tooth.
This is no way to present a case. No information has been given as to the patient's age,
What are you going to do?
sex,
What
or
kind of,
race.
procedure are you going to use on her?
Well, basically, I'd like to use a number 17 forceps and simply luxate the tooth until it comes out.
Okay, you go ahead.
Hurts a
Tell
lot
me if you have
could
any
not
trouble
really
at
be
all.
termed the technical language of our profession. By the way, you may not have ever seen the orange pill before, but you can look them up in the identification section of the physician's desk reference. You have not given a diagnosis. Pain is not a diagnosis. It is a subjective symptom. Oh, yes, the number 17 forcep is used for lower molars, not uppers.
Okay, I'm back.
And the faculty member's behavior wouldn't win him Dentist of the Year award either. The proper scrub technique includes the use of a brush. Paper towels are entirely inappropriate. There's nothing really useful he can get from the trash can. Oops, that glove is contaminated. There he goes again, and again. The light handle is undraped and therefore not sterile.
Okay, I'm just going to numb your tooth up with this needle, okay?
Use of the word needle may cause some of your patients to terminate the procedure before you've done very much.
Connie, reception area, Connie.
Well, I hope he's hitting all of the branch nerves. The countertop is not sterile. The errors come thick and fast now. Now he's writing in the chart with his gloves on. Not too swift, and certainly not aseptic. Uh-oh. Now what's he going to do?
Feel.
I feel sick. I feel like I'm gonna faint.
Don't worry about it.
My, that's
Probably
reassuring.
nerves. We'll be back in a couple of minutes, okay?
I can't believe he's going to leave her all alone.
All right. That sounds like something
Hey,
the doctor
Tom.
really
How you doing, Ryle?
All right.
Good to see you.
Yeah, what's up for Friday night now?
Well, you know, we were going to have the party later on, but what I'd like you to do is you and Diane
Marvelous.
stop
The only
over
thing
my
he
place
hasn't done with his gloves is,
He's gonna be
no,
there.
he did it now, he
Well,
scratched his
pants,
nose.
clothes, a grub, you know, the usual list of characters.
Do you want us to bring Connie?
Yeah, why don't you ask her, see if she wants to come with, okay?
All right, all right.
Because I know Mo and the Grub said last time they really enjoyed her company.
She was a riot.
They
I
said
couldn't believe
they
it.
said she was the life of the party, to be truthful with
She
you.
was.
Witty,
She really
aren't
was.
they?
Do you want us to bring anything, you know, beforehand?
Why don't you bring like a case of beer, okay? Because I already have like some mixers set up,
All right.
okay?
All right, that'd be no problem.
So we'll see you about 7 then,
All right.
okay?
Excuse me. I'm gonna get back to the patient.
All right, all right. How many people can we expect afterwards?
Figure about 25 to 30. It'll be a small party,
All right.
okay?
All
So
right.
we'll have more than enough to drink.
All right,
Okay,
I
Riles?
get back. Yank that
I'll see
suit.
you later.
All right.
Sure, shake
Good
hands
luck
now.
with that.
Marvelous.
Okay, I'm back.
The
Okay,
least
let's
he could
get
do
that
is have the
tooth out
patient
now.
properly draped. And he never even asked her or tested to see if the area was properly anesthetized. Well, she's not screaming, so at least he's lucky, even if he's not too bright. It's not generally necessary to engage in a wrestling match with your patient to remove a tooth.
There we go. Bite down on that. That wasn't so bad, was it?
Maybe not for him.
Here's some instructions for you to read, and I want you to follow these for me.
If she doesn't understand
Okay,
everything in
we're all
those
done.
post-op instructions, the
Take
least he
your
can
joints out
expect
for
is a
me,
call
okay?
at midnight. The unfortunate patient can suffer anything from prolonged bleeding to poor healing.
Okay, Mrs. Jackson, you want to come with me?
Now he's discharging her without having a faculty member sign out the case. I suppose that after what has been going on here, it's the only smart thing he's done today. Our assistants are acting here. They do not treat their patients so abruptly.
No, that's it. Take care of yourself.
Well, now you've seen it all. The good, the bad, and the ridiculous. By the way, each of the errors you've seen here in Program 3 have occurred here in the oral surgery facility. I'm happy to say, however, they've not all been inflicted on the same patient. The 3 programs in this series have been designed to help you and your patient avoid these kinds of problems. I'm certain that they will. I'm happy to welcome you all here to the oral surgery clinic. Good luck.